Hi all of you, and today we are meeting up with a discussion on NEET SS 2021. NEET SS 2021 session is planned to propose to happen in 10th January 2022 is for the NEET SS exam. So after a lot of postponements, finally it has come up in Jan 10th of 2022 of NEET SS. So as the announcement came from National Board of Examinations, and here we are to discuss what are the important and salient features that are there for NEET SS 2021 exam to be conducted in January 10th, 2022. So we go ahead with the discussion on each and every aspect about the date of the exam, cutoff date for the completion of application, and also about the criterias, eligibility, feeder branch, and the syllabus, preparation strategy, all that we are going to discuss in this video. So stay tuned and we will discuss each and every aspect in detail. Yes. So basically all of you know me, and for those who have been seeing me for the first time, my name is Dr.K.Vinayak Senthil, and I'm basically a cardiothoracic surgeon and founder and faculty of Speed Medical Institute, and Speed has been for serving the exams for super specialty aspirants and PG aspirants for more than 2 decades, and it has trained more than 2 lakh students for higher medical education exams. So here we are to discuss the features of NEET SS exam is going to happen on 10th January. So NEET SS 2021 Information Bulletin, National Eligibility cum Entrance Test Super Specialty, the admission for DM, MCH, DrNB super specialty courses. Now the important dates. What are the important dates that we should know? The online application submission starts from 1st of November, that is today, and from 3 p.m. onwards and up to 22nd November. This is very, very important. So there are 22 working days. So 22 days for you to do this, and the edit window for all applicants, okay, is from 1st December to 7th December. Very, very important. 1st December to 7th December 2021, and final edit window for rectifying deficiencies or any of those aspects which are given here from 20th December to 23rd December. An issue of admit card is on 3rd January 2022, and examination date is very, very important, is 10th January 2022. So the cutoff date for qualifying MD, MS, DNB broad specialty qualifications towards the determination of eligibility for appearing NEET SS 2021 is 30th November. Very, 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 very important number. Very important number. It is 30th November 2021. So all those students who want to appear for this exam, they should have done their completion before 30th November 2021. And declaration of results is by 31st of January 2022, and commencement of academic sessions for the term is 15th February 2022, and last date to which students can be admitted or joined or 31st March 2022. So when we could see all these dates, and it's the 10th January, and even NESS we discussed in the last video, and kindly go ahead and click the link in the YouTube channel of Speed Medical Institute. So I have done a detailed discussion on NESS, and most of the dates are almost 10 to 15 days overlapping with each other. And so that after giving both the exams, students can attend the respective counseling and choose the specialty of their choices. Okay, now contact numbers. So what is the board that is going to conduct? It is the National Board of Examination is going to conduct this exam, and the helpline number is given, and the email ID is also given, and the official website is also there, and most of you know it. If not, kindly make a note of this. So there are any correspondence that you want to make, and kindly get on to the either phone number or the email ID to communicate to them. Okay, so the phone support will be available on these lines from this time, from the 1st November 2021 to 31st January 2022, from 9:30 a.m. to 6 p.m. from Monday to Friday. Okay, so 10th January, the examination day, so it is 7 a.m. to 7 p.m. and these are the important information from this page. So all these abbreviations most of you know, so I am not going into those details. So because this will be available for you in a PowerPoint slides also, I will ask them to post for you. Now, introduction is national. NEET SS is the eligibility cum ranking examination prescribed as a single entrance examination for admission for various DM and MCH and DrNB super specialty courses, and as per the National Medical Commission Act of 2019. Now, what all the institutes will come under this and what will not participate in this? So, that is very, very important. Now, NEET SS 2021 shall be a single eligibility entrance examination, as all of us know, for super specialty course for the academic year 21 and 22. Now for this is for all DM and MCH courses in the country, including all private medical colleges, institutions, universities and deemed universities, and all DM and MCH courses at Armed Forces Medical Service institutions, and all DrNB super specialty courses, except for direct 6 years DrNB courses. Now, the following medical institutions are not covered because all these are covered under NEET SS. That is AIIMS, PGI Chandigarh, AIIMS Delhi, New Delhi, and also other AIIMS allied to New Delhi, and JIPMER Pondicherry, NIMHANS Bengaluru, and Sri Chitra Tirunal Institute of Medical Sciences and Technology, and Thiruvananthapuram. So, all this will not participate in NEET SS because they have a separate INI SS exam. So, they have a separate INI SS exam. Okay, right. So, eligibility criteria we have already discussed. The candidates who are in possession or recognized postgraduate medical degree or a provisional pass certificate of MD, MS or DNB or an equivalent recognized qualification are likely to be in a possession on the same by 30th November 2021. Very, very important, in accordance with the eligibility feeder specialty qualification for super specialty courses as mentioned in Annexure B. Okay, so this is a very important information that you should know. So 30th November 2021 should have completed by 30th November 2021, and minimum of a provisional certificate is required for the submission. Okay, so rest of the things are routine, and most of you know it. And the scheme of exam, very, very important, the scheme of exam for NEET SS. So it is very, very clear that from 4.3.2, the pattern of examination is going to be 40% of questions shall be from all eligible feeder broad specialty courses, and remaining 60% shall be from super specialty courses selected by the candidate at the time of online submission of application form. So whatever the specialty that you're going to, whatever specialty you're going to choose, okay, so 60% of that questions will come from that particular specialty. Understood? The pattern of 40% of questions, the pattern of 40% of questions shall be from all eligible feeder broad specialty that I have discussed, and 60% from super specialty courses selected. Now, question paper, there shall be a separate question paper for each super specialty course, very, very important. So, whatever the super specialty or the clubbed group, we will be seeing clubbed group also, there will be a separate paper, okay, not a common paper, it's a separate paper. And total number of questions will be 100, very, very important number, 100, and shall be divided into two parts, part A and part B. Understood? And it is given here, all the questions shall be at PG exit level. Okay? So, this is the information given in the brochure. Part A, the question paper for any super specialty courses shall comprise of MCQs from the eligibility feeder broad specialty courses. In case there is a single feeder broad specialty course for a particular super specialty, part A, okay, will comprise of questions from only one broad specialty. For example, MS General or DNB General Surgery is the only feeder broad specialty for a MCH urology. And part A of urology questions paper will comprise of questions from general surgery. That means an entire general surgery. So 40 questions from entire general surgery will be asked. Okay, for super specialty courses having multiple feeder broad specialty courses, part A will comprise of questions from all the eligible feeder broad specialty courses. I mean, for example, suppose somebody is applying for surgical oncology, and people from ENT, people from Obs Gynae, and people from general surgery can apply. So in that, the feeder branch specialty becomes multiple. So they can have questions from all those feeder branches. For example, here they have given an example, the eligible feeder broad specialty for specialty course of cardiology or general medicine, pediatrics and respiratory medicine. So Now what it means? It means the questions could be asked from general medicine, pediatrics and respiratory medicine. Very clear? Therefore, part A of cardiology questions paper shall comprise of questions from all 3 feeder broad specialty courses: general medicine, pediatrics and respiratory medicine. So this is very, very important. Okay, it's very, very important that part A of multiple feeder broad specialty which is applicable, then questions of 40 will be divided, probably 13 to 14 questions for each, probably 15 questions for general medicine, say 12 questions or 13 questions from pediatrics, or 12 questions or 12 to 15 questions from respiratory medicine, like that. Now part B, the question paper, it shall comprise of 60 questions pertaining to concerned super specialty. The question shall be of a PG exit level. I mean, they have mentioned the specified standard here. Shall cover the topics from clinical practice. See, this is very, very important. Clinical practice and basic sciences as applied to the concerned super specialty. Very, very, very important. See the points to be noted. So they have given as a PG exit level standard for that particular specialty, but it will cover clinical practice. That means clinical scenario based questions can happen, and also basic sciences as applied to the concerned super specialty could be asked. See, probably if it's going to be say if it is a cardiology, then probably cardiac anatomy, cardiac physiology, cardiac pathology. So such kind of questions of applied basic sciences could be asked. So it's going to be the 60 questions are going to be of a PG exit level standard as given in the brochure, and those questions can be from that specialty plus that based on clinical scenarios. Probably there could be some images or there could be some pictorial presentations with a clinical based question and applied basic sciences. There could be some basic science questions could be asked. Okay. Now they have given it very clearly here in this chart. Very, very clearly shows as part A is 40% weightage, questions from the eligible feeder broad specialty and specialties of a particular super specialty. Part B is 60% weightage, questions from a concerned super specialty or a group of a clubbed super specialty. We will see what are the clubbed super specialty at the PG exit level. Okay. Now what do you mean by clubbed super specialties? So certain DM and MCH courses which has less number of seats having a single common feeder broad specialty course has been clubbed together. Each clubbed group of super specialties shall be treated as one for the purpose of online submission of the application form and generation of question paper. For example, neonatology, pediatric gastroenterology, pediatric cardiology. I'll show you in the next slide. It is very, very clear what are clubbed. See that, for example, you'll be able to see these are the clubbed courses. Suppose it's going to be this clubbed, what are this thing? Cardiac anesthesia. So anesthesia people can give a clubbed specialty together, one paper. Organ transplant anesthesia and critical care, pediatric and neonatal anesthesia. And suppose pediatric people can give, so one paper can choose all this because the number of seats are less. Neonatology, pediatric gastroenterology, pediatric cardiology, pediatric nephrology, pediatric oncology, pediatric hepatology and pediatric critical care. Super specialty courses which has been clubbed together, again the list goes here. Number 3 is surgical gastroenterology and GI surgery, are together a single paper, and writing a single paper they can choose either of this. And also hepatobiliary and pancreatic surgery. So surgical gastroenterology or GI surgery and hepatopancreatic or biliary surgery together. Now vascular surgery, cardiovascular and thoracic surgery, and thoracic surgery and pediatric cardiothoracic and vascular surgery. So all these are clubbed together as a single paper. And neurology and pediatric neurology, and 6 is neuroradiology and intervention radiology, gynec oncology and reproductive medicine as a single paper. So after giving a single paper, they can choose according to the merit list, whatever the seat they want, according to availability. Okay, so that's what the club specialty means. Now we are here to know about the marking schemes, and before that, how many specialty one can choose? One candidate can opt for only 2 super specialty courses, and clubbed group at the time of online submission of the application form based on their eligibility for the concerned super specialty. Broad specialty qualification eligibility for the admission to a particular super specialty course shall be as per the postgraduate medical education regulation. Okay, what is the duration? What is the duration of actual exam? for candidates choosing this exam is going to be 1 hour and 45 minutes. 1 hour and 45 minutes. Okay. Likewise, the total duration of exam of the candidates opting for 2 super specialty courses and club groups shall be 3 hour 30 minutes. So it's going to be 3 hour 30 minutes in case they're going to choose 2 super specialty courses or clubbed group. So it's going to be 3 hour 30 minutes. So however, candidates opting only for 1 super specialty course or clubbed group will not be allowed to leave the examination or premises until the completion of the entire exam. That is also important. So marking schemes. So there shall be 25% of negative marking for incorrect answers. No marks will be given for unattempted, an allocation of marks for each question as follows. See that correct response will have 4 marks and incorrect response will have reduction of 1 mark and unattempted will be not awarded any mark, it's 0. Understood? So marking is about 4 marks and will be 1 mark that will be deducted for negative. Okay. Now this is about the allocation of time, and you can see all candidates to enter the examination center and commences from 7 a.m. See the time, 7 a.m. and entry closes the examination center at 8:30 a.m. and grant access for the candidate login is 8:45 and candidates login to the read the instruction is 8:50 and exam start time is sharp 9 and exam ends at 12:30. Okay, 12:30. Now the examination fees will be 4,250 rupees as mentioned in the brochure. Now when there is a tiebreaker, what are the things, before the tiebreaker, what are the troubleshoots that can happen and how it can be, actions can be taken. So this is very, very important to me. This because the technology era, all this are prone to happen and you should know what actions can be taken. So if disruption happens or power failure happens during the exam time, after the candidate has logged in, either for 1 or more candidates, so the standard action is no action necessary. The timer will stop when the failure occurs and will resume when the failure is rectified. So nothing, there is no loss. And there will be no time loss in allocated for exam. So whatever the time you are allocated, the same time will be managed. If the candidate machine is locked and during the exam, the loss of connectivity with the primary server. So what it can happen, the IT manager of each examination room verifies and unlocks the candidate's account and the timer starts from the same time where the student has left. And there will be no time loss again for the allocated time of examination. If the candidate complains of any specific issues in the machine, example the screen flickering, mouse issues or system getting locked or hanged up repeatedly. So on reporting the issue, the IT manager or invigilator verifies and locks the candidate machine and the candidate is shifted to an allocated seat, a buffer seat in the same or the other lab during the examination. So if there is a problem like in the system itself, and then there is one more system which is given, and again there is no time loss. So what they are trying to tell you is, whatever the difficulty happens, there is not going to be a time loss for the allocated time. So whatever the time that you have left for not writing the exam, the same time will be counted as you come back to the exam. That's what it means. So these are the centers which are available. All the major cities, metros and all major cities are available. So you can choose whichever the city close to your place and you can give your exams in that particular place. So validity of NEET SS 2021 result. The validity of results shall be only for the current academic session of, so it has been 2021-22 admission. Understood? So, and this is a general criteria. Now, if it's going to be the breaker criteria, in the event of candidates obtaining the same score and how it can be calculated and assigned, the ranks can be assigned and merit list can be taken for the counselling. The candidate having a lesser number of negative response, see that? Lesser number of negative response in the overall paper can be placed higher in the merit list. Candidate obtaining higher score in part B. So part A and part B is there. Part B is 60 questions. Will be placed higher in the merit list. This is option B. And next is candidates having lesser number of negative response in part B of the question paper will be placed higher in the merit list. So what we are trying to understand from here is, so overall there should be a less negative, and if at all, if the comparison comes, so instead of part A is a general feeder branch and part B is a specialty. So whatever happens in the part B, you should be very careful that there should be less number of negative scores, and there's a higher score in part B compared to A, and they'll be given a position, and lesser number of negative response in part B again counts for the higher merit list position. Older candidates will be placed higher in the merit position. Candidates securing higher aggregate marks in percentage in Next, option E will be, in all MBBS professional examination will be placed higher in the merit list. So they have 6 ways where they can put up in a tiebreaker to choose a person in a tiebreaker. Okay. So publication of merit list, candidates securing 50th percentile or more in each super specialty specific merit list shall be declared qualified. Very, very important. So this is very important, 50th percentile. 50th percentile. Now admissions to DRNB super specialty courses. See, this is very, very important. There's going to be one exam even for that. So admissions to the DRNB super specialty courses except for direct 6 years courses for 2021 admission shall be done through NEET SS 2021. Very important. So it's going to be a single exam on 10th January, and based on that, it is not only for MCH or DM, it's also for DRNB super specialty courses. Admissions can be taken up. And there shall be a common counselling for all super specialties. See that? There will be a common, only one exam, common counselling for DM, MCH and DRNB super specialty for NEET SS 2021 at the national level to be conducted by the Medical Counselling Committee of the Directorate of General of Health Services, DGHS, Government of India. So very, very clear, very clearly said. So going to be one exam, through that DM or MCH, DRNB super specialty courses will be allocated in the counselling. So these are the DRNB super specialty courses offered for 2021, like cardiac anesthesia, cardiology, cardiothoracic and vascular surgery, clinical hematology, clinical immunology and rheumatology, and critical care medicine, endocrinology, gynec-oncology, intervention radiology, medical gastroenterology, medical genetics, medical oncology, neonatology, nephrology, neuroanesthesia, neurology, neurosurgery, pediatric cardiology, pediatric critical care, pediatric surgery, plastic and reconstructive surgery, and surgical gastroenterology, surgical oncology, thoracic surgery, urology, vascular surgery. So all these other courses which are available, just have a look at it. So, if an option is available to do a DRNB and it is also equivalent to a DM and MCH, one can choose accordingly. That's the reason why I just want to mention all this. Okay. So the prior entry qualification of DRNB super specialty courses will be the same. So there is no change. There will be the same for the corresponding DM and MCH courses, and any change in the feeder entry application for any DM and MCH course will be automatically applicable for DRNB. So process is going to be the same. So need not worry. Candidate desirous for a seat in the above mentioned DRNB super specialty course in 2021 admission shall be required to register themselves for NEET SS 2021. So if you are interested in doing DRNB super specialty, you have to go through this exam. That is very, very clear from this. And appear in the common counselling conducted by Medical Counselling Committee. Okay. So all those details which are available in the website of www.mcc.nic.in. Okay. And National Board of Examination, www.natboard.edu.in. Okay. So the list of super specialty courses and the corresponding eligibility feeder specialty qualification, this is what we are also looking for to complete. And you can see here the anesthesia, the people from anesthesia feeder branch. So they are, they can are eligible to apply. Those students who have finished both DNB or MD in the particular, see that DMD or DNB in anesthesia can apply for all this, for this DM courses or DRNB courses. In that, DRNB courses are available for cardiac anesthesia, neuroanesthesia, critical care medicine, but DM alone is available for organ transplant anesthesia and critical care and pediatric and neonatal anesthesia. And those people have done MD or DNB biochemistry, and they have a course available is DM or DRNB clinical hematology. Very, very good news for people who have taken biochemistry. And MD or DNB emergency medicine people have completed it, and they can apply for DM critical care. And people who have done ENT, MS or DNB ENT, they are eligible to write MCH head and neck surgery or MCH or DRNB surgical oncology. So it's very, very clearly, this table is very important because it gives for what DRNB is available and what DRNB is not available. And those who have done, all those who have done MD or DNB general medicine, they are eligible for a lot of seats which are available for DM. The options are DM or DRNB, clinical hematology, nephrology, medical oncology, endocrinology, cardiology, pulmonary medicine. See, pulmonary medicine, there is no DRNB. See that? No DRNB. And neurology, medical gastroenterology, and again, hepatology, there is no DRNB. Just make a note of it. And you can see clinical immunology and rheumatology and DM, and again, there is no DRNB for infectious disease, only DM. And again, you can say DM and DRNB for critical care medicine, and DM, and again, no DRNB for pediatric neurology. Okay. And again, you need to understand that for head and neck surgery, and even for head and neck surgery for ENT people, and there is no DrNB for head and neck surgery. Now, MS general surgery or DNB general surgery students can apply for all the super specialty courses of plastic and reconstructive surgery, and surgical gastroenterology, and hepatobiliary and pancreatic surgery, and urology, and vascular surgery, and cardiovascular and thoracic surgery, pediatric cardiothoracic and vascular surgery, neurosurgery, pediatric surgery, surgical oncology, head and neck surgery, and hand surgery, and endocrine surgery. So here we need to say that DrNB courses are not there for hepatopancreatic biliary surgery, and for pediatric cardiothoracic and vascular surgery, head and neck surgery, and hand surgery, and endocrine surgery. Now, people who have completed MD and DNB microbiology are eligible to do virology, DM virology, and MCH or DrNB neurosurgery people can do head and neck surgery, MCH head and neck surgery, and MS and DNB orthopedic people can do, options are do an MCH pediatric orthopedics, MCH hand surgery, and MCH or DrNB surgical oncology. Okay. Now, MD, MS or DNB obs-gynae people can do gynec oncology, reproductive medicine and surgery, and surgical oncology. Here what you need to understand is MCH reproductive medicine is there, DrNB reproductive medicine is not there, not shown here. MCH DrNB for gynec oncology, MCH DrNB for surgical oncology. So here, from here, very, very clear that surgical oncology, the feeder branch eligibility, again we have one more table to go for OBG, for orthopedics, general surgery, and also for ENT. So the questions, probably 10 questions from each can come for people who want to do surgical oncology. Okay, now pediatric people, MD and DNB pediatrics, the students can apply for a wide range of courses which are available for DM, like clinical hematology, endocrinology, pulmonary medicine, pediatric neurology, clinical immunology, rheumatology, infectious disease, critical care medicine, pediatric cardiology, pediatric gastroenterology, pediatric hepatology, pediatric nephrology, and pediatric oncology, neonatology, cardiology, nephrology, hepatology, neurology, pediatric critical care, and medical oncology. See here, they are eligible for both adult DM courses and also for pediatric DM super specialty courses. Okay, that's what this entire chart means. So it's given very clearly in one table that MD or DNB pediatric students will be eligible for both pediatric super specialty, DM pediatric super specialty courses, and also adult DM super specialty courses. Okay. So pathology people, MD and DNB pathology people can do clinical hematology and oncopathology, and MD DNB psychiatry people can do geriatric mental health, and MD DNB pharmacology people can do clinical pharmacology, and MCH and DNB plastic reconstructive surgery people can do, and head and neck surgery also, MCH. And MD and DNB radio diagnosis can do intervention radiology and neuro radiology. Again, so this comes in a reverse format. I think this we have very, very clearly done. And also the MD and DNB respiratory medicine people are eligible to do DM pulmonary medicine, infectious disease, cardiology, and critical care medicine. And MD and DNB radiation oncology people can do DM or DrNB medical oncology. MCH DrNB surgical oncology people can do MCH head and neck surgery, and MD tropical medicine people can do DM infectious disease, and any MD, MS, DNB board specialty program are eligible to do DM or DrNB medical genetics. So medical genetics is open to everyone across the medical and surgical fields. Okay, so this is what is about the eligibility requirement, and it has been in a format, it is done already. So this list is available for you, the name of the super specialty course and the course type and the prior eligibility requirement. So almost similar for what we have done earlier, and this will be available for you to go through at leisure. The courses like cardiac anesthesia, cardiology, clinical hematology, and what are the prior eligibility feeder branch. So it is, we have already seen this. People of biochemistry, pediatrics, general medicine, and pathology are eligible for clinical hematology. That already we have seen in a different format. This is in a different format. There is no difference, and it's almost the same. Okay, for immunology and rheumatology, clinical pharmacology, critical care medicine. See that if for critical care medicine, people who have done emergency medicine, it's a consolidation. This chart is a consolidation. General medicine, respiratory medicine, anesthesia, and pediatrics, all for critical care medicine. And almost for endocrinology, I said both MD general medicine and DNB general medicine, or people who have done pediatrics will be eligible to do the DM super specialty courses. That's what is given here. Okay, so there is no change. It's already known to us, correct? Yes. So again, the pediatric super specialty, the people will be eligible only for pediatric federal branch, only pediatric federal branch. Okay. Again, similarly for MCH, I mean, people who have done MS or DNB general surgery will be eligible for all MCH super specialty courses. And this is very, very important. I mean, I'm to discuss that head and neck surgery. What are the feeder specialties? ENT, MS or DNB ENT, MS or DNB general surgery, MCH or DrNB plastic and reconstructive surgery, MCH or DrNB surgical oncology, MCH and DrNB neurosurgery. That means the questions will come from all this. And there is a difficulty actually, though the feeder branch is there, and the feeder branch questions on part A will be there. Okay. So similarly, all this has been discussed for MCH super specialty courses for students of MS and DNB general surgery. And surgical oncology. And surgical oncology, other than the courses, the surgical oncology, the feeder branch already we discussed, general surgery, ENT, orthopedics, obs gynae. So I think 10 questions from each can be there in part A from the feeder branch. So that's what it says. Okay. So we have consolidated. It's almost all, the entire aspect what is given in the prospect for NEET SS academic year for admission of 2021 and 22. And what I want to tell you is either it be NEET SS 2021-22 session, or it's going to be any SS 2021 or 22 session. And the students of speed, you are all well equipped, and you have all the contents, all the necessary contents which are available in the form of video lessons, or in the form of notes in the PowerPoint sessions, in the note session, or the topic-wise test, or the grant test. It is more than adequate for you to crack both the exams altogether. So one preparation, the one good news is for all those students at this point of time who are appearing for the exam and who want to apply for this exam, one good news is that you have enough and adequate resource today to manage both the exams for NEET SS 2021-22 and any SS 21-22 sessions comfortably, and you are well equipped, and we are starting up, and from the first week of November till December 15th, we have been on go for high yield topics, tables, images, and recent advances for every specialty wise. And for past 2 months we have worked on the general aspect of part A of a feeder branch. Now we are on full go and full throat with a lot of energy and enthusiasm from all the faculties of speed to go on for specialty wise classes for you to give complete aspects of all that could be asked in exam. Either it be a concept, or be a fact, or be an image based, or a table based, or clinical scenario based, or basic sciences. We have given a basic sciences to you in the app. So all that armamentarium that you require, all the resource that you require is there with you at any time, anywhere in Speed Learning app with you, and we are there for you in Telegram group or in WhatsApp chat, and even in the live session on a daily basis according to the schedule of your specialty. The faculties are on. You can ask doubts and clarify in the same session, and I'm available to you for you to clarify your doubts, and I'm here to guide you on all those perspectives, because as a faculty, as a post MCH and post DM faculties, we know what is required for these exams. So we have understood very well, and will be able to guide you and mentor you and to get on to your next level of super specialty journey. And so thanks for being with us, and definitely we'll be supporting you until you reach your dream seat of super specialty program, either DM or MCH or DrNB. Once again, I wish you all the best, and I'm telling you, we are there to handhold you until you reach your position comfortably. Once again, best wishes for both exams, for NEET SS 2021 session on 10th January 2022, and a fresh year, and 2022 starts, and this exam will come, and any SS, and again the date will be announced very shortly, and give both exams. Give both exams. My request is apply for both the exams, and whatever comes as a result, we'll take it and decide and go from there. Okay? Once again, I wish you all the best and all the success. Thank you very much. God bless all of you. Bye.